Welcome everybody to Young Doctors. Today we'll be talking about chromosome 15 and its mutations. Many mutations such as the Angelman syndrome, Prader-Willi syndrome, and Marfan syndrome, as well as others, occur on chromosome 15 due to deletions. First, we'll talk about Prader-Willi syndrome. Prader-Willi syndrome is a disease present from birth and results in conditions such as obesity, reduced muscle tone and mental ability, and other defects that may be visible. Prader-Willi syndrome is caused by the absence of segments 11 through 13. In most cases, this region is missing due to deletion. Many genes in this region are normally suppressed on the maternal chromosome, so in order for on the paternal chromosome, and when these paternal-based genes are absent or disrupted, it results into Prader-Willi syndrome. Genes found in the Prader-Willi syndrome chromosomal region code for the small ribonucleic protein SNRPN. SNRPN is involved in mRNA process, an intermediate step between DNA transcription and protein formation. Now we have Elin and Caitlin talking to you about the Angelman syndrome and its characteristics. Thank you.
Thanks, Kendor.
Okay, so what we all want to know is, what is Angelman syndrome exactly?
Angelman syndrome is a mutation in our genes. The mutation itself is on a gene known as UBE3A on chromosome 15. This causes a frameshift mutation within the chromosome.
Yes, a frameshift mutation is a mutation that it occurs due to the fact that a base is added or deleted from the sequence. An example is the sentence, "Who ate the pie?" You add the letter L and the sentence is no longer readable. This is like adding a base to a sequence of DNA.
What are some common symptoms of this syndrome?
Some symptoms may present as trouble walking or balancing, or even trouble speaking. Sudden outbursts of laughter can also be quite frequent with these children.
Yes, and since children are already happy and clumsy at an early age, parents don't realize their child has Angelman syndrome until they grow up and develop.
Some characteristics of a person who has this mutation can present as smaller head or flattened back of the head, deep-set eyes, wide smiling mouth, prominent jaw, wide teeth, lighter hair, and skin and eyes.
Angelman syndrome.
Thanks, Caitlin. Now we're going to talk about Marfan syndrome. Marfan syndrome is named after Antoine Marfan, a French doctor who first described the condition in 1896. Mutations in the FBN1 gene found in chromosome 15 cause this syndrome. The FBN1 gene provides instructions for fibrillin 1, which goes on to create microfibrils. These microfibrils become part of the fibers and provide strength and flexibility to connective tissue. Microfibrils also hold growth factors and release them at the appropriate time to control the growth and repair of tissues and organs. A mutation in the FBN1 gene can reduce the amount and or quality of fibrillin 1 that is available. As a result, growth factors are released inappropriately. This condition is inherited in an autosomal dominant pattern, which means one copy of the altered gene is enough for the person to get the disorder. At least 25% of classic Marfan syndrome cases result from a new mutation in this gene. These cases occur in people with no history of this disease in their family. Thanks for watching.